Good morning. Welcome to Good Company today. It is Wednesday.
Well, after downing that blueberry dessert that Loretta just made, I might need a tummy tuck. And maybe you're feeling the same way when you look down and you feel a little bit more than a pouch. Well, we're going to be talking about tummy tucks today and whether or not you might be a good candidate with Dr. Jason Leedy, who's a plastic surgeon. It's good to have you here.
Nice to be here.
Okay, so now that I ate a big piece of that blueberry crostini or whatever it was called, it was amazingly delicious. How long would it really take somebody to work all of that off, especially if it was building up around their stomach?
Oh, well, probably a day or so on the treadmill, I would think.
When you perform a tummy tuck on somebody, how many inches are you usually removing?
Well, it's not, we don't remove all that much in the way of weight or inches. It all depends on an individual and how much there is to actually improve upon. But the procedures reshape the body, and it makes it so that the figure's nicer, that they fit better in their clothes, but they're not going to lose a significant amount of weight.
Now, there are some people who put on a little bit of weight and really could probably work it off. So at what point is someone a candidate for a tummy tuck?
Well, you're right. You could work it off, and sometimes liposuction is a nice option too. But an abdominoplasty or tummy tuck is indicated for people where there's extra skin or there is muscle laxity. And that usually happens after significant weight fluctuations or pregnancy. And with pregnancy, what happens all too often is the overlying skin of the tummy gets stretched, and it's stretched beyond its capacity to snap back and repair itself. And the muscles also, though, are pushed to the sides. And so people will often, they'll work out, they'll exercise, they'll strengthen the muscles, but the muscles will always be off to the side. And so in someone where there's muscle laxity or extra skin, then an abdominoplasty is the answer.
Do you see more men or women coming in for tummy tucks?
Well, women mainly, but men are also candidates if they have those criteria. And men usually, they've had some significant weight loss, say after gastric bypass surgery, and that's someone that an abdominoplasty is beneficial for. But by and large, it's women, and that's secondary to pregnancy and the changes that occur with that.
Okay, well, you brought some pictures today, and we're going to take a look at some examples of what can happen through the pictures. So here's our first before and after.
Now, this patient is a typical one. She has fullness of the abdominal wall. She has muscle laxity. She's had a few children. There's also some stretch marks there, and she had what's called the full abdominoplasty. And in that surgery, an incision goes hip to hip in the bikini line. The skin of the abdominal wall is lifted up, and then it's tightened. It's like straighten the sheets on the bed. You pull it down to make it snug. And the muscles underneath there are tightened as well. The belly button then is brought back through the abdominal wall to its new position. And there she's seen approximately 3 months afterwards.
And does your belly button go back to normal from what you originally remember it being somewhat?
Well, the belly button is changed, certainly, and sometimes people have a little outie, or it's wider than what they'd like, and so yeah, it can be reshaped.
Okay, and here, let's talk about what was done here. This
is a more extreme case. This patient actually underwent gastric bypass surgery, so she has multiple rolls of extra skin, and all the exercising in the world would make no improvement to that. So she underwent a full abdominoplasty as well, and in that surgery I did the same thing as the last patient, just removed more skin. All the skin's released of the abdominal wall, and the extra is removed.
I know a lot of women are concerned about stretch marks. Can those ever be faded? Or, I mean, do they ever completely go away?
There's no good treatment for stretch marks. There's no skin cream that will make it go away. Usually excision is the only treatment option, and luckily for most women, stretch marks occur below the belly button to the pubic bone. And in that area, that's a tissue that's removed with a tummy tuck.
Okay, let's talk about this picture
here.
So
this patient, she has mainly just some loose skin on the abdominal wall. She also has some muscle laxity. She's another typical patient after pregnancy. And she underwent a full abdominoplasty, and in that same thing is done, and the scar is down in the bikini line. And she has a very natural-looking belly button there as well. And this patient has a characteristic fat distribution on the abdominal wall that a lot of people see, where there's fullness above the belly button and then also below. And an abdominoplasty is the best treatment option for them. Liposuction would do nothing more than just remove that fullness, but the skin would remain.
Is this a painful procedure to go through?
Well, it's actually an outpatient procedure. Most people can go home the day of the procedure. And that's accomplished by numbing the areas fully prior to going home. But the majority of patients go home. Now, recovery, though, takes anywhere from 2 to 3 weeks. And most people need that much time off of work before they can get back to their job. And then longer, 4 to 6 weeks before actual exercise.
And in that 2 to 3 weeks, are you talking complete bed rest? I mean, could they walk around a little bit?
Absolutely, yeah. Okay. No, they need to get up and move around, and that's encouraged. And though they need some assistance at home. So usually within the first week, people are back to putting on makeup and they're taking showers, you know, they're feeling more like themselves. But those first couple days, it's not an insignificant procedure, and it's important to see someone that does this regularly to ensure an optimal outcome.
Absolutely. Well, if anyone should have any more questions that we couldn't get through in this amount of time, give Dr. Jason Leedy a call. He's with the Cleveland Plastic Surgery Institute. The phone number there is 440-461-6100, or you can log on to his website, Dr. Leedy with 2 E's, .com. Thank you so much for being here.
Andrew,
Good to
thanks
see
for having me.
All right, stay with us. We'll be right back with more of Good Company. We're talking about